Hi dost, how are you? So in today live we have daily 10 MCQs challenge. So in this 10 MCQs, what exactly the important 10 MCQs they should ask in competitive exam? Before start this video, please share, subscribe and like the video. In this daily 10 MCQs, today first question, right? Yeah, ready to answer the today first question? Totally in this 10 MCQs, first question is the nerve which supplies the diaphragm, right? The nerve which supplies the diaphragm, right? Which nerve is supplying the diaphragm? You know that, right? You know that very well. See here, if we have to check, there is a diaphragm is a muscular organ. Diaphragm is a muscular organ. This diaphragm is helping in human body for respiration process, especially inspiration. So you are taking the gas, that means either the oxygen, right, and gas. When you are inhale a gas, that inhale mechanism by the anatomical structure of a diaphragm. So diaphragm, very simple, if you have to explain, diaphragm is a respiratory muscle. Diaphragm is a respiratory, you know well, right? Diaphragm is a respiratory muscle, dost. And this diaphragm, the question is, which nerve control this diaphragm in human body? If we have to check, so there is a different nerves given in the option. First one diaphragmatic, second one phrenic, third one C is a radial, and D is a sciatic. Which is the right answer? Write down in the comment. Fast give your answer, right? So which is the right answer? Diaphragmatic or phrenic or radial or sciatic? Which is the right answer? See, most commonly we can able to confuse with these options because of here asking the diaphragm, and there is an option of diaphragmatic. So where we similarly thought that this diaphragmatic is the nerve which supply the diaphragm, but it's wrong. Diaphragm controlled by the nerve which we called as a phrenic nerve. This phrenic nerve we also called as a respiratory regulatory nerve. So respiration mechanism can be regulated by a nerve. Respiratory muscle can be regulated by a nerve called as a phrenic nerve. Dost, in human body, this respiration mechanism controlled by a nerve called as a phrenic nerve. What about this radial nerve? So radial nerve, you know well, right? So this nerve, right, which especially for the arm. And if you have to go with that sciatic nerve, which is the longest nerve of human body in the femoral region. This can be seen, right, in femoral region. This can be seen in femoral region. This is one of the longest nerve of human body. Longest nerve of human body called as a sciatic nerve, but respiratory mechanism can be controlled by a nerve called as a phrenic nerve. Dost, the right answer is a phrenic nerve. Let me go with the next question. Hope you understood, right? The next question, if you have to check with the next question, what exactly the next question, right? So here we can go with the next question, right? So in the next question, if you have to check, right, the next question is ready. Blood supply of right lungs, or so here the blood supply of lungs, you know, right? You know well those, right? Lung is a mission which filter the gas. Lung is a human body mission, right? Which filter the gas, which excrete the gas, right? And which inhale the gas. So this is called as a one of the filter mission. So here blood filtration, especially the gas, which gas in the blood is filtered by a mission, a organs which is called as a lungs. So this lungs, right, blood supply by what exactly? In the lung, we can see two type of supplies, right? So that is what speciality of lungs. Here there is a two types of blood supplies we can see. One is exchange of gas, that means a pulmonary circulation. One type of supply which is called as a gas exchange, that is called as a pulmonary circulation. In this pulmonary circulation, only gases or exchange, that you remember, dost. In pulmonary circulation, there is only gases or exchange. But who will supply the nutrition to the lungs? That is a challenge. Here, this pulmonary circulation is not supply the food to the lungs. It's only filter the gas, dost. But here, the lungs take in the food, that means a nutrient, by one more circulation, that is called as a brachial circulation. This brachial arteries or supply the nutrition to the lungs for the energy purpose. Then, but what about this pulmonary artery and pulmonary vein? If we have to see this pulmonary artery and pulmonary vein, which called as a pulmonary circulation, only exchanging of gas. Oxygen come into the circulatory, carbon dioxide excreted from the circulation. That is the exchange of the gas. Oxygen go into the blood, carbon dioxide excreted from the blood. That exchange called as a pulmonary circulation. So those in this lungs, these two special circulatory mechanisms we can see. One which is called as a pulmonary circulation, another one is called as a brachial circulation. So in this given four options, now the right answer is, those in the comment, write down which is the right answer. Yes, pulmonary artery we can see, because of pulmonary artery carries the deoxygenated blood for the exchange purpose, and pulmonary vein is carries the oxygenated blood after filtered oxygenated blood to the heart. This is from the heart, right? From the heart, pulmonary artery carries the oxygenated blood from the heart to lungs, and pulmonary veins carries the oxygenated blood. Pulmonary arteries or carries the deoxygenated blood from the heart to lungs, and pulmonary veins carries the oxygenated blood, right, from the lungs to heart, and brachial artery which supply the blood to the, right, so lungs, because of nourishment for the energy purpose. So these all circulations we can see in the lung area. So the answer is all of the above. That is what exactly those here. The question is very logic. The question is very logically they should ask. Easy question, but logic is there. If you have to check with the third question, early sign and symptom of a hypoxia. Those you know well. You know well about the hypoxia, right? Hypoxia. These two differentiations you know well. Those here hypoxia, right? If you have to see, right, hypoxemia, right? So there is a hypoxemia is nothing but, right, there is a lack of oxygen in blood. But if you have to see hypoxia, there is a lack of oxygen in tissue. Those in tissue you know well, lack of the oxygen in tissue or lack of the oxygen in cell. So when this body cells lacking, means receiving insufficient of oxygen, that state which called as a hypoxia. Hypoxia is a state when our body tissues or cells are not receiving sufficient oxygen. That medical term called as a hypoxia. If oxygen level is less in the blood, that is called as a hypoxemia. Emia means in the blood, lacking of the oxygen. This is two different medical terminal words. The question is early sign and symptom of hypoxia. You know well those. A sensitive organ of human body lacking of the oxygen called as a brain. When the oxygen levels is a decrease in the body, especially at the area of tissue or cell, the first damage organ is a brain. Brain is a first damage organ due to the lack of oxygen, due to the decrease of oxygen. At the time, this brain will send the signals. The first early signal from the brain when lacking of the oxygen is restlessness. Restlessness is the first sign. We can see this restlessness sign during the hypoxia condition. This restlessness and apprehension and restlessness both we can see due to the lacking of oxygen in the tissue and cell, especially in the brain area. So that we can remember. Early sign and symptom of hypoxia is nothing but here restlessness and apprehension. That is very important. And a late sign we can see cyanosis. Cyanosis is a late sign. Late sign. This is not a early sign. Cyanosis we can see in hypoxemia. Cyanosis we can see in hypoxemia. In hypoxia, cyanosis is a late sign. Those cyanosis is a late sign. Bluish discoloration of your skin. Bluish discoloration of your area. This bluish discoloration is a later sign. But early sign is restlessness. That is what very confused bits ask in competitive exam. Question is very easy pattern, but options which create the confusion in the competitive exam, that's what you remember this, right? Convulsion is not that much of relevant to the hypoxia. In the convulsion, there is a sign of hypoxia, but it's not that much of relevant. Altered level of consciousness, it's come but intermittent. Altered level of consciousness is a intermittent sign. Early sign of hypoxia, we can see that restlessness. Right answer is B. Right answer is B, those. Let me go with the next question. Let me go with the next question, those. What exactly the next question? So, the complication associated with tracheostomy, if you have to go to the right opening of trachea, artificial airway opening, which is called as a tracheostomy is a procedure of artificial airway opening. So if we have to see this artificial airway opening, which is called as your tracheostomy. Those, if you are open the trachea, if you are open this airway, right, pipe, if we are opening this airway pipe, what exactly the associated complication? If we have to open this artificial airway, if we are open this at a pipe, we can see the early complication. They given the options: damage to the laryngeal nerve, and bronchoconstriction, and pneumonia, and excessive secretion. Those here we can see that. If we have to check this complication associated with the tracheostomy, most common complication we can see that, right? So there is a risk of bronchoconstriction. One more we can able to see, that is a damage to the laryngeal nerve. These two complications we can see followed. But if they ask that data, right, so there is no early and no late, so severe if you consider, that is called as a damage to the laryngeal nerve, right? Damage to the laryngeal nerve, it's a severe, right? Later we cut that bronchoconstriction, sir, but it's not that relevant. That relevant is rare, but we can see very simply that is a damage to the laryngeal nerve. That is most common complication associated with that tracheostomy, right? If you have to check with the next question, right? So next question, blue bloater is known as, we can see this blue, then bloater. This blue bloater we also see in blue, you know that due to the cyanosis we can see that blue, right? and bloating, automatically we can able to see that, bronchial constriction. So here bronchial obstructions, in these options, blue bloater, where we can see, right, this especially we can see in the, right, bronchial area, especially this, we can see the bronchial area due to the COPD. But here the question is, due to the COPD, but blue bloater is also known as, another name of blue bloater they are asking. Another name of blue bloater which is called as a chronic obstructive bronchitis. That is another name. This can seen in COPD. Those you know that COPD, chronic obstructive pulmonary disease. This also called as a cold, chronic obstructive lung disease. Here we can see specially, right, a different sign, right. One is called as a asthma sign, right, bronchiectasis, right, chronic bronchitis, right, bronchitis, chronic obstructive bronchitis, right, and one more, right, empyema. So these most commonly we can see, right, especially in the COPD condition. But those here, the question is very simple. Blue bloater is also known as a chronic obstructive bronchitis. It's one of sign in the COPD. That is very important to remember. Very important to remember in the competitive exam. Don't confuse with the similar options. The challenging of competitive exam is to make a confusion in the option. But you should be very confident with your options. That is very important. Right. Then go with this question. Fifth question, right answer is chronic obstructive bronchitis. Then go with the next question. The functional unit of kidney, you know those. Kidney is similar to the lung. Lung remove the wastage of gas from the blood. Kidney remove the metabolic wastage from the blood. These both organs which are designed for removing the wastage from the blood. Blood wastage filtered by two organs. Those you know. Blood wastage filtered by two organs. Blood wastage. In the blood, two types of wastage. One wastage called as a gases, especially carbon dioxide. Another type of blood wastage called as a metabolic waste. Especially if you have to see that urea. Urea is one of the metabolic waste. See, one waste of blood called as a carbon dioxide, right? So removed by the organ called as a lungs. And one more wastage which is called as a metabolic waste of urea can be removed by the organ called as a kidney. Those, right, you know this clarity. Clarification of blood wastages are two types. One is called as a gas wastage called as a carbon dioxide removed from the lungs. Another one, blood wastage called as a metabolic waste called as a urea removed by the kidney. But in the kidney, which part, that means which area we called as structural functional unit of a kidney. If you have to see the kidney structure, right, so there is a bean shape of kidney. There is a different cortex area, medullary area, renal pelvis area. This is what exactly the gross anatomy of the kidney we know well. In that, the functional and structural unit which we called as a nephron, Bowman's capsules is a first part of the nephron, cup-like structure, which filter the blood, which take the blood into the kidney filtration, nephron reabsorption. That cup-like structure here we can see here the type of a cup. This cup-like structure called as a, right, a Bowman's cover the glomerulus. Right, Bowman's is a capsule which cover the glomerulus. This glomerulus and Bowman's capsules which take the arteries and veins inside the nephron for the filtration purpose. So after this, we can see that both structure, that means glomerulus and Bowman's capsules, both structure we call as a Malpighian corpulus. Thus we can see. And here non-functional unit like a pyramidal structure in the kidney called as a pyramid. This pyramid just like a pyramid structure in the kidney, which consists of a millions of nephron. Then the fundamental functional unit of kidney called as a nephron. There is a nephron fundamental functional unit, right? So right answer of this sixth question is nephron. If you have to check with the next question, the normal serum creatine level, those you know well, creatine is a waste product of muscle metabolism waste. If this muscle is metabolizing, there is a waste generated. So muscle metabolism waste called as a creatine. Muscle metabolism waste in the body called as a creatine. Those, this creatine can be excreted by kidney only. Creatine can excreted by kidney only. But here question is in the serum creatine, normal creatine levels in the blood. The question is normal creatine levels in the blood. So normal creatine levels in the blood, we can see 0.5 to 1.1 mg per deciliter. So especially if you have to see in the females, this is 0.5 to 1.1 we consider for the female. If you have to go to the male, 0.7 to 1.3 mg per deciliter. This is a right value for the male, and female 0.5 to 1.1 mg per deciliter. So in given options, the right answer of serum creatine levels, that means creatine in the blood 0.5 to 1.1 mg per deciliter. This is what exactly the right answer those. So in the seventh question, the right answer is A. If you have to go with the next question, right? Very simple question they are asking here. Inability to urinate despite of desire is called as. If you have to see that, right? So there is a urine, inability to urinate. So there is a void of urine. So urine is not coming from particular area of urinary bladder. So urine is not coming out from the urinary bladder. That state medically we called as, that term medically which we called as. Write down in the comment box fastly write down in the comment box what we called that state. Those inability to pass the urine. That person is not able to pass the urine, even fill of the bladder, means if the passing sensation, the person is not passing the urine is not coming out, that state medically we termed as retention. But if the person is voiding the urine, means not controlling to stop the urine, that state called as a incontinence. Incontinence means urine is continuously passing. This person is not controlled the pass of a urine, but retention is nothing but urine is not coming out. So this is what exactly the two terms. If the person is not pass the urine, right? Not pass the urine, that state called as a retention. Continuous void the urine, not controlled the urine void, that is called as a incontinence. But there is a two more options given in the so C and D. So enuresis means bed wetting. Those you know that, right? Bed Bed wetting is nothing but here during the night time. Urinated. Nighttime urination called as a enuresis. There is a one more word that is called as a encopresis. Encopresis is nothing but here stools, defecation, fecal matter. These stools, right? Incontinence, involuntary, stools, involuntary pass. Right? If that person is passing the stools involuntary, that is called as a encopresis. If the stool, right, so urine, right, involuntary pass of urine in the night time, that is called as a enuresis. Continuous urination, that is called as a incontinence. Urine not able to void, that is called as a retention. These are the terminal words. So inability to urinate, right, that desiring but not passing, that is called as a retention. That is called as a retention, right? That is very important to remember this. Right? By this retention, the complication is fullness of bladder, right? But not able to void the urine. So catheterization is a best option for the retention of the urine. Right? So go to the next question. Right? Here, the early sign of renal carcinoma. Renal carcinoma, that means the cancer sign of kidney. If we have to say this, dost, there is a cancer sign of the kidney, which is a early sign we can see in the given option. Dost, write down the right answer. Dysuria, flank pain, pyuria and hematuria, which is the right answer. Which is the right answer? Dost, here, which is the right answer? Early sign of renal carcinoma. If we have to see this, early sign of renal carcinoma, that sign called as a dysuria. Dysuria is the early sign. Early sign is a dysuria, but a late sign is a flank pain. A late sign is a flank pain. But these two options, pyuria and hematuria, right? Sorry, right? If we have to see this, sorry with this, right? Sorry with this, because of here there is a option of hematuria given. Right? So this hematuria here we consider as a early sign, right? Pyuria and dysuria both we can see, especially, right? Pyuria and dysuria we can see, especially, right? Infection. In the infection we can see this, right? But those very important to remember this. Early sign of renal carcinoma is a hematuria. This is a early sign, right? Followed by dysuria we can see, right? Then later we can see the flank pain, and pyuria is a infective sign. So this is what exactly the, right? So options they given. So ninth question, early sign of renal carcinoma, early sign is hematuria. That is very important to remember, right? Then next question, if you have to go with the last question of today's discussion in top 10 daily challenging question at last, cause of pain in urolithosis. Uro means urine, lithios means a stone. So in urination process, start from the kidney to at urethra, there is a tract called as a urinary tract. So in the urinary tract, there is a stone formation, means obstructed of a stone, especially calcium stone. This obstruction of stone, right, because of what exactly the cause? What exactly the cause in given four options? Let me check. Pressure exerted by the stone? No. Right, movement of stone? Yes. Decreased water intake? No. Right, that can be, right, disintegrated of the stone. Here, the obstruction main cause, means a cause of pain here, especially there is a cause of pain. The cause of pain in urolithosis, especially we can see that that is a movement of stone. That is a movement of stone. In movement of stone, especially we can able to see this, the cause of pain, that like a simply like a radiated pain, which is called as a flank pain. So most commonly cause of pain in urolithosis we can see due to the movement of stone, dost. So this is what exactly today 10 challenges and next 10 challenges we can check in next session. Until then, thank you. Be careful in your preparation. Confused with the option, right? So very challenging task of your preparation, right? Thank you for watching this video. Please like, share and subscribe with our dost. Thank you. Take care. Bye bye.